Here are our goals for legislation this year. All Americans should have affordable, high-quality health care. Patients and physicians should be part of this discussion and part of the shaping of the legislation. There indeed needs to be a permanent fix to the flawed SGR payment system for physicians, and we're going to come back to that. Liability reform. You know why people are listening to us about liability reform? They didn't listen to us in Congress when it was all about the premiums that we paid for liability coverage. They're listening to us because finally economists who have said this for a long time are publicly saying defensive medicine adds to the cost of health care. It adds to the cost and you're not addressing it. So it's in the context of the high costs. And we absolutely believe that we need to do better by our primary care physicians. We need to encourage our patients to do things in terms of wellness and prevention, but that means we have to put the money where the mouth is. That means we have to stop paying so beautifully for acute interventional rescue care and ignoring prevention. That's really important. And then finally, as is what's driving this issue, clearly what happened yesterday in Congress, is whatever we do has to be fiscally sound and sustainable into the future. The AMA is very committed to giving physicians tools. Some of those tools, and I'm going to do this very quickly, are performance measures. We've been involved in the creation of performance measures so that doctors know how they're doing and know how they can improve. For years through the consortium, which I'll talk about in a minute. These other things we've been heavily involved with. It was a pleasure to see Lucian Leap here. We were both on the National Patient Safety Foundation board a while ago, and the AMA is unequivocally involved in the quality arena and has been for many years, and that basically, from my own standpoint, that's what my career has been both in the local and state and national arena for the last 15 years. These are the acronyms. If you don't recognize all the acronyms, you really need to get the dictionary and the glossary and figure it out, because these are the folks that have come together. These are coalitions of not just physicians. These are physicians, these are health plans, these are hospital administrators, these are people like Mark McClellan and Don Berwick and the National Patient Safety Foundation. These are people who are not just representing a constituency, but have come together for the good of the country to try to move the quality arena and patient safety. The consortium, how many of you in the audience know what the consortium is? Okay, the rest of you need to, because this is an organization where all the states, all the specialty societies send folks to try to help develop performance measures. The AMA convenes it, staffs it, and funds it, but the specialty organizations and the state organizations pay the travel for the people who they send as representatives. This is really critical, and the consortium has developed the vast majority of the performance measures that have been adopted by CMS for the reporting by physicians. It also includes non-physicians. Patient advocates, consumers, employers, and nurses are there because, frankly, quality crosses all the professions, and medicine is a team sport. We are very committed to evidence-based performance, and the Physician Consortium for Performance Improvement, the PCPI, usually referred to as the consortium, covers a broad range of clinical conditions and is also developing measures for overuse, misuse, and underuse, the terms that you've heard earlier today. We're very committed and very pleased to what happened in the stimulus bill, that there is going to be an investment in health IT for meaningful use. And it's important that we recognize that most of the benefit goes back to others, not to physicians. Physicians have been slow to adopt. They've been slow to adopt everywhere because they're worried about interoperability. They've seen disasters where their hospital, their local pharmacies, their local emergency rooms have a different system. They can't communicate. They've been hesitant to invest in something that is expensive and hard to sustain if it's not going to be something that's interoperable. So we've needed the national standards. We're now getting, Joe Heyman's been very involved in that, as have many of the others of you. Now, let's talk turkey, though. We still have to stay in practice. And this is what's happened. Now, this is what is projected for the Medicare costs. And every physician needs to know that January 1, 21.5% cost will go to every physician who sees Medicare patients. And virtually every physician in practice has some except the pediatricians who may have a few disabled kids on Medicare, but virtually everybody else is going to be affected by this. And it's not a simple issue. It's very important. It's not one we're walking away from, and we were very disappointed yesterday at the vote in the Senate. And we will remember it for a very long time. And we will remind those who stood up against a permanent SGR fix. Some of them were the same people who proposed an almost identical fix 2 years ago when they were in power. We will remind them of that interesting ethical switch. This is the situation for you in Massachusetts if those cuts were to go through. Now, do I think they're going to go through? No. I think there will be a Band-Aid. But I'm going to show you in a minute what the Band-Aid's going to cost and why we are so disappointed that Congress, which knows the Band-Aids increase the cost, Congress has not been willing to bite the bullet and fix this once and for all, because every year the cost goes up. This is what would happen to you in Massachusetts. Every physician, on average, would lose about 13% in payments, and it would just affect many, many people. You know that many private insurers tie their payment to a multiple, one way or the other, to Medicare. You know that military families covered under TRICARE, those payments are tied to Medicare. This is very serious. This, you've already heard about the access issue, and it was interesting to me because it is only 6.9% of people say they couldn't see a doctor here in the last 12 months, but that was mostly due to cost. That was mostly due to cost. The country is watching Massachusetts, and we need to learn from you. Many of your Medicare beneficiaries are not wealthy. Look at the numbers. 29% of Massachusetts Medicare beneficiaries are below the 150% of poverty level. This is the policy that was passed by the AMA last June when the issue of a public option came up. And what we did is we passed a policy that said we will examine all health system reform alternatives that are consistent with these principles. Pluralism, meaning we are opposed to a single payer. That may offend some of you, but we are. And if you really love single payer, you need to go with me to Congress every year and fight that annual death dance. And you may not be so in favor of single payer. But at any rate, pluralism, freedom of choice, both for doctors and patients, freedom of practice, and universal access for patients. That is the lens through which we examined the bills in Congress.